Hello, welcome back. The topic we are going to discuss today is about diarrhea after gallbladder surgery. The previous videos we have talked about what is gallbladder, its function, diseases, what is the solution, and gallbladder stone. The treatment of choice is gallbladder removal. Okay, somebody has undergone gallbladder removal surgery and they come with complaints of loose motion or diarrhea. Okay, what could be the reason and what is the treatment? The scientific data shows after the gallbladder surgery, 20% of the people can experience a mild to moderate or even severe diarrhea or loose motion. Most of the time they will say, I have a loosey stool. But that automatically that can get cured after some time. So when people come with the diarrhea or loose motion, the reason being why it happens, the reason being the gallbladder is a storage organ where it stores the bile. That is now the gallbladder has been removed and there is no storage bag. So the bile flows freely into the small intestine and reaches the large intestine. So there is a dribbling of bile acids or bile into the small intestine, large intestine. When the large intestine gets more bile, that can cause a diarrhea or loose motion. Okay, what to do? What is it a big problem to think? No. Most of the people, they can experience this loosey stool up to 6 weeks. After 6 weeks, usually that will settle down. The people, even after suppose 6 weeks, there is a loose motion, but it's not disturbing. We can just like that, observe the patient and ask them to, avoid taking any medication. But if it's really disturbing them, like it disturbs their day-to-day activities or it disturbs their traveling, then what are the doctors can examine, they can ask some questions, they may even run some tests, but most of the time everything will be normal. Then they can prescribe some medications like anti-diarrheal medication they can be prescribed, or they can give anti-ulcer medications like proton pump inhibitors or antacids they will suggest. So most of the time, most of the people get cured with these medications and time. But in spite of all these things, if it again it's prolonged and it's disturbing, or after the diarrhea they feel tired, their nutrition electrolyte imbalance happens, then it has to be treated with certain medications like cholestyramine. Cholestyramine is nothing but bile salts which neutralize the bile acids. So they neutralize the bile. This cholestyramine neutralizes the bile acid and they can improve the diarrhea part. And the doctor may also suggest certain dietary changes. They may ask you to avoid milk and milk products except curd or yogurt. They will ask you to stop milk and milk products. They ask you to stop fatty, oily, cheese, mayo, ghee, all these things to be avoided, or fried things to be avoided. They'll ask you, the doctor may ask you to improve your fiber intake. So fibers can do wonders, and avoiding milk products, fatty meal, fried items, avoiding all these things, plus the PPA, the proton pump inhibitors, anti-ulcer medications or cholestyramine can give you a good solution. So ask your surgeon, he can examine and he can prescribe you the best treatment for you. Thank you.